A hernia occurs when an internal organ or tissue pushes through a weak spot in the surrounding muscle or connective tissue wall. This can happen in various parts of the body, but it most commonly occurs in the abdominal area. The pressure from the organ or tissue creates a noticeable bulge. This creates a bulge or protrusion that can be visible or palpable. The bulge may become more apparent when you are standing up, bending down, or coughing. It can sometimes be pushed back in or disappear when you lie down. Hernias are common, affecting millions of people worldwide. They do not discriminate and can affect individuals of all ages, genders, and backgrounds. Statistics show that hernias are a significant health issue globally. They can occur at different locations in the body with varying symptoms and severity. Common types include inguinal, femoral, umbilical, and hiatal hernias. Each type has its own set of characteristics and potential complications. Hernias are often caused by a combination of factors, including muscle weakness and strain. Muscle weakness can be congenital, meaning present at birth, or it can develop later in life due to various reasons. These factors can be present at birth or develop over time due to aging, obesity, heavy lifting, or chronic coughing. Activities and conditions that increase pressure on the abdominal wall can contribute to the formation of a hernia. Understanding the different types of hernias, their signs and symptoms, is crucial for early detection and treatment. Symptoms can range from a painless lump to severe pain and discomfort, especially when lifting or bending. Seeking medical attention is essential if you suspect you have a hernia. A healthcare professional can diagnose the condition through a physical examination and recommend appropriate treatment options. While some hernias may be asymptomatic, others can cause significant discomfort and lead to complications if left untreated. Complications can include obstruction of the intestines or strangulation of the hernia, which can cut off blood flow to the affected tissue, leading to serious health issues. Inguinal hernias are the most common type of hernia, accounting for a significant majority of cases. They occur in the groin area, where the inguinal canal is located. The inguinal canal is a passageway for the spermatic cord in men and the round ligament in women. An inguinal hernia develops when a portion of the intestine or fatty tissue protrudes through a weakness in the abdominal wall in the inguinal canal. This can result in a noticeable bulge in the groin, which may increase in size when coughing, straining, or lifting heavy objects. Inguinal hernias can occur on one or both sides of the groin. They are more common in men than in women due to the anatomical differences in the inguinal canal. Femoral hernias occur in the upper thigh, just below the groin crease. They are less common than inguinal hernias, but are more prevalent in women than in men. The femoral canal, a small passageway for blood vessels and nerves, is located in this area. A femoral hernia develops when a portion of the intestine or fatty tissue pushes through a weakness in the abdominal wall into the femoral canal. This can create a bulge in the upper thigh, which may be tender to the touch. Femoral hernias are often smaller than inguinal hernias and may be less noticeable, especially in the early stages. Umbilical hernias occur at the site of the belly button, also known as the umbilicus. They are common in infants and young children, particularly those born prematurely. In infants, umbilical hernias often close on their own as the abdominal muscles strengthen. In adults, umbilical hernias are less common and typically develop due to increased pressure in the abdomen. This pressure can be caused by obesity, pregnancy, fluid in the abdomen, ascites, or chronic coughing. Umbilical hernias can vary in size and may protrude more noticeably when coughing, straining, or lifting heavy objects. Section 5. Incisional hernias. A risk after surgery. Incisional hernias occur at the site of a previous surgical incision, often causing discomfort and complications. They develop when the abdominal wall weakens around the scar tissue, allowing internal organs or tissue to protrude through the weakened area. Any surgery that involves an incision in the abdomen can increase the risk of developing an incisional hernia, regardless of the procedure. Factors that can contribute to incisional hernia formation include infection after surgery, poor wound healing, obesity, and other health conditions, and strenuous activity before the incision has fully healed, which can exacerbate the risk. Incisional hernias can develop months or even years after surgery, making long-term monitoring essential. Section 6. Hiatal hernias. When the stomach protrudes. Hiatal hernias differ from other types of hernias in that they occur within the abdomen rather than through the abdominal wall. They involve the stomach and the diaphragm, the muscle that separates the chest cavity from the abdomen. A hiatal hernia develops when the upper part of the stomach pushes through an opening in the diaphragm called the hiatus. This opening allows the esophagus to pass through the diaphragm and connect to the stomach. There are different types of hiatal hernias, but the most common is a sliding hiatal hernia. In this type, the gastroesophageal junction, where the esophagus meets the stomach, slides upward into the chest cavity. Section 7. Recognizing the signs, a crucial step. Recognizing the signs and symptoms of a hernia is crucial for seeking timely medical attention. While some hernias may be asymptomatic, others can cause a range of symptoms that vary depending on the type, size, and location of the hernia. It's important to remember that hernias do not heal on their own and require medical intervention. If you notice any unusual bulges or experience any discomfort in the areas commonly affected by hernias, it's essential to consult a healthcare professional for diagnosis and treatment. Section 8. Symptoms of a hernia: pain, swelling, and more. Hernias can present a variety of symptoms that can significantly impact daily life. The symptoms of a hernia can vary depending on the type, size, and location of the hernia. For instance, an inguinal hernia may present differently than an umbilical hernia. Some people may not experience any symptoms, while others may have mild to severe discomfort. This discomfort can range from a slight ache to intense pain that disrupts daily activities. Common signs and symptoms of a hernia include a bulge or swelling, which is often the most noticeable sign of a hernia, especially when standing, coughing, or straining. This bulge may become more prominent over time. Pain or discomfort, which may be sharp or dull, and it may worsen with activity or lifting heavy objects. This pain can sometimes radiate to other parts of the body, making it difficult to pinpoint the exact source. A feeling of pressure or fullness, which may be felt at the site of the hernia. This sensation can be persistent and may not go away even with rest. Nausea and vomiting, which can occur if a hernia obstructs the intestines. This can lead to severe complications if not treated promptly. If you experience sudden, severe pain, nausea, vomiting, or an inability to pass gas or have a bowel movement, seek immediate medical attention, as these may be signs of a strangulated hernia. A strangulated hernia is a medical emergency and requires urgent care to prevent serious health risks. Section 9. Seeking medical attention, the importance of early diagnosis. If you suspect you have a hernia, it is crucial to seek medical attention promptly. Early diagnosis and treatment can prevent complications and reduce the risk of the hernia worsening. A healthcare professional will perform a physical exam to diagnose a hernia. They may also order imaging tests, such as an ultrasound or CT scan, to confirm the diagnosis and determine the size and location of the hernia. Treatment options for hernias vary depending on the type, size, and symptoms of the hernia, as well as the individual's overall health and medical history. Section 10. Different hernias, similar concerns, a recap. In this section, we will revisit the key points discussed about hernias, their types, and the importance of understanding them. Hernias are a common medical condition that can affect people of all ages, from infants to the elderly. They occur when an internal organ or tissue pushes through a weak spot in the muscle or connective tissue. Understanding the different types of hernias, their signs and symptoms, is essential for early detection and treatment. Early recognition can lead to more effective management and better outcomes for patients. While each type of hernia has its unique characteristics, they all share the common feature of a protrusion of an internal organ or tissue through a weakness in the surrounding muscle or connective tissue wall. This protrusion can cause discomfort, pain, and other complications if not treated promptly. Inguinal, femoral, umbilical, incisional, and hiatal hernias are distinct types that affect different areas of the body and present with varying symptoms. For instance, inguinal hernias are more common in men, while umbilical hernias are often seen in infants and pregnant women. Seeking medical attention promptly if you suspect you have a hernia is crucial for preventing complications and ensuring appropriate management. A healthcare professional can provide a proper diagnosis and recommend the best course of action, which may include lifestyle changes, medication, or surgery. Remember, hernias do not heal on their own, and early diagnosis and treatment can significantly improve outcomes and quality of life. By being proactive and informed, you can take the necessary steps to address this condition and maintain your health and well-being.